questions, but we'll keep it fairly tight.
Okay, so this is our project, making the most of an opportunity, quick and easy access to nicotine replacement therapy. And it's a joint venture between Oxleas and Royal Borough of Greenwich and the Tobacco Treatment Service. So this is the project team. So we have Oxleas, you've got myself, Tash and Helen, who can't be here with us today. We work for the Greenwich COPD team. We've got Poonam from the QI team, and pharmacy, Sarah Elliott, and Jennifer from the Tobacco Treatment Service, and Yvette, who also can't make it here today. So the aims of our project was to increase the number of those accepting a referral from the Greenwich COPD Diagnostic Clinic to the Greenwich Tobacco Treatment Service. And from the patients we referred, we wanted to increase the number of patients achieving quit status by 20% by December 2023. And we would do this through holistic assessment and individualised treatment plan, early support at the point of diagnosis, and timely access to nicotine replacement therapy. So the challenges for our project: historically, there are low quit rates in Greenwich. It's quite a complex group of patients that we see. They have lots of physical and mental health conditions. The Greenwich Borough has poor socio-economic status, which is associated with high smoking prevalence and disease prevalence. And it's not a quick fix to get people to quit smoking, but we identified an opportunity for a meaningful conversation with our patients with support and counselling. So what happened previously? So patients would get referred to the COPD diagnostic clinic. They're generally referred by their GP, and they'd have symptoms of breathlessness and or cough, but they'd also have a history of smoking. They would attend for lung function tests, which include spirometry and pheno, and they'd see myself or Tash in the clinic. Anyone that was identified as a current smoker would be given very brief advice, VBA, and if they accepted support, we'd refer them then to the Tobacco Treatment Service via an online portal. Patients were then followed up by the Tobacco Treatment Service, usually within a week. But many patients were lost to follow-up. There was poor engagement and, again, low quit rates.
Yeah, thanks. Yeah, the drivers for change, as Harry's already said, smoking's still a big issue. It's very much a big issue in the COPD client group. Over 80% of people with COPD have smoked, and over 50% of those coming to their clinic are smokers. And we know smoking is a very entrenched addiction. It's still the #1 preventable cause of ill health and death in this country. So it's really key that we try and help smokers make that decision to quit smoking. And we do know, as Kerry said, it's that teachable moment when they're sitting in front of a health professional, which is heightened. And we know from previous research we've done that they're 50% more likely to take up a service when being spoken to by the health professional and actually engaged in that process. As you can see, Greenwich has got a very high cardiovascular rate and cancer rate. We also know it's still very difficult to engage with smokers. We know smokers have as many as 20 attempts to stop smoking. So that moment when they're in front of a health professional and that teachable moment is key that we harness and make the most of, and also enable patients to see that it's an easier process and give them the tools to do that.
So this is our planning and implementation timeline. So the area in pink, this was our planning and development stage, where we collaborated with pharmacy to plan stock list delivery and safe storage of the NRT products we were going to prescribe in clinic. Ratification of our SOP, our Standards of Operating Procedures, to include medicines management, and signing off by a senior management team. Most of you would know is quite a lengthy process. We also did a tobacco dependence focus group, and I'll talk about that a little bit more in the next slide. So in March 2022, we started our diagnostic clinic following COVID. And then a couple of months later, this is when we started the QI project. In July, Kerry completed her level 2 smoking practitioner training, and then I did mine a bit later because I was on mat leave at the time, so I did mine when I came back. And that's when we both started to prescribe NRT in our diagnostic clinic, and we're hoping to introduce vapes soon. We're just finalising our stock. So from the focus group, we asked smokers what would help to improve their quit rates or successfully stopping smoking, and these were some of the themes that they came back with. So having empathy, the readiness to stop smoking, somebody to listen, a buddy, someone friendly and supportive, someone who is aware of their feelings and not judgmental, the stress management, because lots of people smoke, not necessarily for many, many reasons, and a lot of that is because of stress and anxiety, and it helps to calm them down, and having some peer support as well. So in terms of what happens now, in our COPD diagnostic clinic, patients who attend the clinic and are identified as current smokers are given the VBA, the very brief advice. And if they accept the support, patients are given level 2 counselling and a quick date is set. Patients are then offered a 7-day supply of appropriate strength NRT patches and a quick acting product. And as I said earlier, we're just waiting for our vapes to get in stock. We would then refer to the tobacco treatment service, and that would be via the online portal. And now patients are now followed up within 48 hours of their clinic appointment and are issued with ongoing prescriptions of NRT and weekly support and phone calls for up to 12 weeks for their treatment plan.
The outcomes, we were really delighted to see the jump in take-up to the service. And this really enforces the importance of a health professional's relationship with the patient. They have such influence. The first jump we can see is over 200%, but the numbers are small, so we don't want to particularly overstate it. But that was when Kerry, the physio, just behind me, actually undertook the training, which is the training to take someone through the treatment plan to help them stop smoking. So that gave her the confidence and the knowledge to talk through the process with the patient, to empower the patient, to let the patient ask questions, and to the whole process be a bit more familiar. And then we can see the jump when actually a big push through Sopstober, through the trust. So that also made not just patients but staff more aware, but that also meant the prescribing of NRT in the clinic. So that was when actually Kerry would actually set a quit date with the smoker in front of her at the time of diagnosis, when their mind was more open to hearing a message that could help them move forward in a recovery. So you can see the jump there, and it's continued to remain above the average point line. So this is something we're continuing because it seems to be really working, and we're getting really positive feedback from both the patients and the health professionals.
Thank you. So next one is So we have collected some feedback from the patients and our staff. So staff, they feel better equipped and have the confidence to have more meaningful conversation with the patient, and it is like more rapport building, and they have more trust in our staff now. And then patient, they have opportunity to give feedback about the experience, and this is in line with our aim, what we try to do, like you said, and we did. So we are offering a choice of NRT. Then patients, they describe the clinicians, they are empathetic and supportive while discussing the challenges. So one of the major feedback from our patient, like they don't feel like they are being judged, why they cannot stop or why they cannot quit the smoking. So this is one of the most important part in quitting the journey, when you are not being judged. All patients, who accept the offer of NRT, they are really grateful that they are receiving the product without having wait to go and buy them. Yeah. So this is some of the patient feedback, and you can read it through. They are really, I love the last one. Your staff are incredible, and we love you, NHS. So thank you so much for hearing, and we are here for the questions.